And back here at home, lawmakers are urging the government to establish a unified contact tracing system to ensure effective monitoring of COVID-19 cases. But the health department says the donation of the official contact tracing application StaySafe.ph has yet to be finalized. Let's hear now from the app developer. We go above and beyond the headlines with David Almirol, the Chief Executive Officer of Multisys Technology Corporation and the maker of this contact tracing application, StaySafe.ph. David, thank you so much for joining us on Newsnight. Why is it taking so long for the government to adopt your StaySafe.ph contact tracing app?
I think in terms of adoption, Rico, StaySafe is really widely used now all throughout the country. Currently, both web app and mobile app, we already have like 15 million users now, especially with our establishment's digital logbook. It's being widely used. But the only concern here is the final acceptance, okay, of StaySafe.ph. The biggest problem is actually the location, okay, where we can transfer the technology. We've tried our best to, to do the donation, but it so happened that we found out that there is, they need to prepare first from their end. If you read the IATF resolutions number 45, it's very clear there that we have to transfer to DOH COVID Kaya system. But when we tried to donate and transfer the technology, so they told us that the COVID Kaya is not yet ready that time. And then in the resolutions number 85, again, they asked us to initiate the donation.
Right.
We complied all the documentation.
But David, the Department of Health's Dr. Tayag is saying that they haven't really started using StaySafe.ph is because that your group is making so many changes and modifications that's causing delays to the acceptance of this donation.
That is not true, actually. That's why we are quite confused in his statement. And in fact, when we're talking to IATF, so there's a lot of updates that we're telling him it's not actually feeded to IATF. So there are confusions, okay, from his end as well, because we asked him to have some kind of like close workshop with us, but for the record, Rico, he only attended like once, okay? So we don't know what's going on because we felt like he's not into accepting StaySafe. We passed all the documentation. We passed the National Privacy Commission. We work with the National Security Task Force, the National Task Force on COVID-19. We also work with the ILG. We work with DTI, but we felt like we're not actually supported by his group, to be honest.
And Dr. Tayag was supposed to join us for this interview on Newsnight, but apparently minutes before we went on air, he backed out and said that he had a meeting at the top of the hour. But, David, the contact tracing czar, Mayor Benjamin Magalong, is really frustrated, over this delayed donation, saying it's affecting the effectivity of the government's contact tracing efforts. Are you frustrated yourself that it's not getting done? It was supposed to be implemented and in place 10 months ago.
We are really, really confused and frustrated because we are working closely with Mayor Magalong. We're working closely with Secretary Vince. And our position here is to use StaySafe to save lives, But we felt like, we're being dribbled, because all they need to do is just to accept the donation, take over everything, and then there you go. They can now continue whatever we're doing. But they made us comply with so many documentation. In fact, when we're talking to NPC told us that, in fact, it should be DOH who will be complying with those documentation already the moment that they take this over, right? If they will be the one to manage all the database. One of the confusion also, Rico, is the contact tracing should be done by NTF, via DILG, okay, not by DOH. So we're quite confused because it's very clear on the briefing because I signed already the deed of donation to the National Task Force on COVID-19, by the way. It's done. The donation was done. But NTF asked us to work with DOH and the ICT at that time. So the main problem is, I think we need to align, we need to align because DOH should be handling the cases, the laboratory cases or the result of the laboratory testing. And the DILG should be the one to do the contact tracing. That's very clear. But we're quite surprised because during several meetings, he's the one already talking about contact tracing and he would like to take over the digital contact tracing. Well, in fact, if you read IATF number 85, it's very clear there, Rico, that the digital contact tracing of StaySafe should be already mandatory to the national government and local government units.
So
It's
why
like
are you
it's
not
violating-
why are you not speaking now directly to the DOH Secretary Duque so at least he could expedite this whole process? Why are we seeing a roadblock here in terms of the comments of Dr. Tayag?
One of the meeting, I even asked him, can we present directly to Secretary Duque so that he will appreciate also our effort, But unfortunately, we're not given chance to present to Secretary Duque. And I was able to present to some of the executive of the IATF. And when I updated them on the success story of StaySafe, they're quite surprised that they are not aware about the success story. So we're quite, what? We don't even know that. So I think it's all about, the missing communication link here and a lot of good deeds. Not only StaySafe, by the way, Rico, even our friends from the IT group, the CDRS, is not also being accepted yet by DOH. So meaning it's not only us who donated the system, Rico. It's not only us. There are several IT groups who donated systems to DOH that is not yet actually accepted by DOH itself because same problem. Dr. Tayag team is actually not ready to take over and they're trying to dribble us in documentation thing. And that's so frustrating, to be honest.
Thank you so much for your insights, David Almirol from Multisys Technology Corporation, the maker of the contact tracing app StaySafe.ph.